Standing outside of the U.S. Capitol building, where we see Senator Angela Alsobrooks, Congresswoman Yvette Clarke, Congresswoman Shantel Brown, and Congresswoman Bonnie Watson-Coleman, along with some women's health advocates and activists. They're talking about fibroids and how it disproportionately impacts Black women, with 8 out of 10. That's 8 out of 10 Black women being affected by fibroids. I happen to be one of those women. Earlier this morning, we had a roundtable inside of the Capitol where we talked about our experiences with actress Lupita Nyong'o, who has been very outspoken about her battle with fibroids. I'm back inside of the Capitol building. I'm with Congresswoman Shantel Brown and Congresswoman and Chairwoman of the Congressional Black Caucus, Yvette Clarke. And we just had our roundtable this morning, which was, I appreciate y'all for having me there, inviting me. Thank you so much. Congresswoman Clarke, if you could tell us why it's so important to get more funding for research.
I serve with a very dynamic woman, Congresswoman Shantel Brown.
Well, thank you.
From the great state of Ohio. I served with one of her predecessors, the Honorable Stephanie Tubbs Jones. And Stephanie Tubbs Jones actually crafted a piece of legislation that we have dedicated to her called the Stephanie Tubbs Jones Research and Education Act. As it turned out, when I first arrived here on Capitol Hill, I arrived with 60 fibroids in my uterus. This was my lived reality. Unfortunately, Stephanie passed on. I knew that I had to continue that mission because I went through such a horrific period of time in my life, even as a representative with respect to fibroids, the lack of knowledge and information around them, what it means in the lives, particularly of Black women, and how we can address it through research from the National Institutes of Health, how we can educate the public about it, and what forms of treatment can be developed.
And now I want to go to you, Congresswoman Brown. What an amazing roundtable you held today.
Yes.
You should be very proud because that was really beautiful. There were a lot of important things discussed, but one of the most important things was the shocking amount of funding that is going toward this research. And when I say shocking, I don't mean in a good way.
Right.
I mean,
less
it's very...
less than 0.5%.
Right.
Yes. Tell us more about that.
So when we consider that the majority of the population is actually impacted by this, and when we consider that 60% of women will experience fibroids, when we consider the fact that 80% of Black women will experience fibroids, and less than 0.5% of research is going towards this condition. Given its prevalence, I think it's important that we make the investment into early detection so we can also address treatment and also normalizing the conversation. I think one of the things that we also got out of the roundtable this morning was that silence doesn't save anybody.
Right.
And so we have to speak up and we have to speak out about it.